Bonjour à toutes et à tous. Hello, everyone. So before I begin, I would like to offer my deepest condolences to the family and friends of the victims of this weekend's terrible events in Nova Scotia. Now, the latest numbers on COVID-19 in Canada. There are now 36,216 confirmed cases, including 1,611 deaths. We've been testing around 20,000 persons per day in the last few days, and for a total of over 555,000 people tested to date. Today, I am going to speak more about people, thoughts, and feelings than numbers and statistics, because each of us, alone and collectively, are what will determine when and how we emerge from this crisis. When it comes to stopping the COVID-19 pandemic, we are all on the front lines, and we all need to do our part. Nothing less than the continued sacrifice of every Canadian staying at home as much as possible and practicing physical distancing is what it will take to stop the spread of this virus. This is still urgently needed to save the lives of our most vulnerable members of society now and to buy more time for researchers to develop diagnostics, vaccines, and treatments that will protect our health system and the health of all Canadians. We're at the start of a new week, though I recognize that these days it is hard to see the demarcation of one day from another, or of weekdays from weekends. I think everyone at home, as well as our essential workers, feel the strangeness, as our daily and weekly routines have become singularly focused on tackling this challenge. But whether you are at home, at your desk, and no shame if you're still wearing pajamas right now, or out on the front lines, taking a moment to pause and reflect can help. My reflection this weekend was on the incredible power of positive voices and of kindness, creativity, and innovation. At times like these, there can be a lot of negativity born out of anxiety, fear, and concern. But if we just turn our attention ever so slightly, we can become aware of the much greater power of even a single positive voice or a single act of kindness. It takes many negative voices to try to push us down, but even one positive voice can have the power to raise us all up. When we think about some of the darkest times in history, what we recall is the inspiring voices that guided and helped us along. If you are feeling down, turn to those voices, or if you can be that voice, speak up and raise people up with you. This weekend, I reflected on how thankful I am for the positive attitudes and many kindnesses shown by Canadians during this crisis. When times get tough and people band together, it is truly inspiring what can happen. These weeks have been hard, and there have been losses, with the most devastating being the loss of our loved ones to this disease. There is a shared sense of this pain, and people are responding with kind voices and music to raise spirits and bring us all together apart. From balconies in Italy to a virtual student choir in Newfoundland and Labrador singing "O Canada," to a world of entertainers and frontline workers coming together in solidarity this past weekend for the One World at Home concert, we are not alone. For everyone who is feeling down, anxious and worried about our future, turn your ears to positive sounds, look for kindness. Humble voices may not be loud, but they are strong, steady, and ready to come together when called. Thank you.
Bonjour. Avant de commencer, j'aimerais offrir mes condoléances à la famille et aux amis des victimes des événements terribles qui se sont déroulés au cours de la fin de semaine en Nouvelle-Écosse. Voici les plus récents chiffres concernant la COVID-19 au Canada. On compte maintenant 36 216 cas confirmés, dont 1 611 décès. Pendant les derniers jours, en moyenne, environ 20 000 personnes sont soumises à un test de dépistage chaque jour à l'échelle du Canada, ce qui porte à plus de 555 000 le nombre de personnes testées jusqu'à maintenant. Aujourd'hui, nous allons nous attarder davantage aux gens, aux réflexions et aux sentiments plutôt qu'aux chiffres et aux statistiques, parce que c'est chacun d'entre nous, individuellement et collectivement, qui déterminera quand et comment nous nous sortirons de cette crise. Dans nos efforts pour contrer la pandémie de COVID-19, nous sommes tous aux premières lignes et nous devons tous contribuer. Ce sont les sacrifices que chaque Canadien continue de faire en demeurant à la maison autant que possible et en pratiquant l'éloignement physique qui nous permettront de mettre fin à la propagation de ce virus, rien de moins. Ces mesures sont toujours aussi essentielles pour sauver maintenant la vie des personnes les plus vulnérables de notre société et donner plus de temps aux chercheurs afin qu'ils puissent mettre au point des diagnostics, des vaccins et des traitements qui protégeront notre système de santé ainsi que la santé de tous les Canadiens. Nous entamons une nouvelle semaine. Bien que nous soyons conscients qu'il est difficile ces jours-ci de distinguer une journée d'une autre ou même une journée de semaine d'un jour de week-end. Nous sommes convaincus que tous ceux à la maison, tout comme nos travailleurs essentiels, ont cette étrange impression, étant donné que nos routines quotidiennes et hebdomadaires ne visent maintenant que le seul but, c'est-à-dire surmonter ce défi. Mais que vous soyez à votre bureau à la maison, sans gêne d'être en pyjama, ou en première ligne, c'est une bonne chose de prendre un moment de répit et de réflexion. Ce week-end, nous avons réfléchi au pouvoir extraordinaire que représente le positivisme, la gentillesse, la créativité et l'innovation. La situation que nous vivons actuellement peut engendrer beaucoup de négativité en raison de l'anxiété, de la peur et de l'inquiétude qui nous assaillent, mais si nous changeons le moindrement notre optique, nous réalisons toute l'importance qui revêt une seule voie positive ou un seul acte de gentillesse. Il faut de nombreuses voies négatives pour tenter de nous faire tomber, mais il suffit d'une seule voie positive pour nous donner la force de nous relever. Lorsque nous pensons aux périodes les plus sombres de notre histoire, nous nous souvenons d'abord les voies inspirantes qui nous ont guidés et aidés à nous en sortir. Si vous avez le moral dans les talons, concentrez-vous sur ces voies positives. Si vous pouvez être cette voie, prenez la parole et encouragez les gens à suivre votre exemple. Ce week-end, nous avons réalisé à quel point nous sommes fiers des attitudes positives et de nombreuses manifestations de gentillesse des Canadiens durant cette crise. Lorsque les gens unissent leurs efforts durant une période difficile, ce qui peut en découler est fort inspirant. Les dernières semaines ont été difficiles et les pertes ont été nombreuses. La plus grande perte était celle de notre cher des suites de la maladie. Nous ressentons tous cette douleur qui nous pousse à faire preuve de bonté et à puiser dans le pouvoir de la musique pour nous remonter le moral et nous rassembler. Que ce soit les Balkans en Italie, une chorale virtuelle d'étudiants entonnant l'Eau Canada à Terre-Neuve et Labrador, ou un événement de solidarité réunissant des artistes et travailleurs de première ligne de partout dans le monde, comme le concert One World at Home le week-end dernier, nous ne sommes pas seuls. À tous ceux qui se sentent déprimés, anxieux et inquiets quant à notre avenir, prêtez l'oreille aux sons réjouissants et portez l'attention aux gestes de gentillesse. Les voix humbles ne font peut-être pas beaucoup de bruit, mais elles sont fortes, constantes et prêtes à se mettre à l'unisson lorsqu'il le faut. Merci.
Thank you, doctors. We will now open the line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking a question in the room, we ask that you make your way over to the freestanding mics. Operator, over to you for a question on the line.
Thank you. Thank you. Please press star 1 on your téléphone keypad if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour toute question. La première question, the first question is from Laura Osman from the Canadian Press. Please go ahead. Your line is open. Votre ligne est ouverte.
Good morning, Dr. Tam. I know you said you didn't want to talk about numbers today, but I do have some questions about the data for you. There were some epidemiologists who were really encouraged and optimistic over the weekend, saying that some provinces may have passed their peak already, that others may be approaching their peak, that the data suggests the reproductive rate of the virus is way down. I'm wondering, when you take all the provincial data together, does the federal picture support that? And what does it tell us about the capacity of our healthcare system moving forward if this trend continues?
Yes, so overall, I think our health system is coping. So I think that is a very critical aspect to maintain in terms of a response. And in terms of, as I mentioned last week, we are seeing the slowing of the growth of this epidemic. We do have a very varied picture in terms of the epidemiology across the country. There are definitely areas of Canada that haven't really seen community transmission, and then, of course, in the bigger provinces where they have. But even those signs are moving towards the positive as well. So I think you've heard some of the updates from British Columbia, for example, but all chief medical officers are trying to be extremely cautious at this time. Even if the outbreaks are slowing down, now is absolutely not the time to sort of change our current stance. We need to keep going on our public health measures. But I think it's a testament to the work of all Canadians that we have managed to move to this more positive direction. I do have to say that there are some concerning areas that we're watching very closely, not just long-term care facilities, the people experiencing homelessness, but certain workplaces, of course, where they may be not necessarily in the workplace conditions. We heard of a work camp in Alberta and other settings where I think we need to take a significant amount of care so that we don't ignite new chains of transmission. So those reproduction numbers, for example, can change quite sensitively to the actions that we take. Thank you.
And one follow-up, Laura?
Yeah, I was wondering about the hospitals that are putting their PPE aside in hopes they can sort of effectively disinfect and reuse them. Has there been any proven progress on that yet, or are we likely to see that PPE discarded eventually?
So I think the first areas of action is always to get more PPE, so pulling out all stops to get supplies. That still remains, but we need to look at all options. So sterilization of respirators, for example, and other PPE is currently being looked at as well. We are working across Canada to, yes, conserve some of these, but also we're now looking at the actual sterilization equipment and having them distributed across Canada. So it remains a aspect of our strategy for ensuring that healthcare workers have the personal protective equipment and that they are protected.
Thank you, operator. Next question on the line.
Thank you. The next question, la prochaine question is from Justin Ling from Freelance. Please go ahead. Your line is open.
Hi there. Dr. Tam, can you talk to me a bit about the situation in Canada's prisons? I know you've mentioned it before as an area of concern for you. You just sort of listed some areas where, poor conditions could lead to a whole new round of transmission. And I'm wondering what advice you're giving the government as to what they should do to avert the spread of COVID-19 inside federal institutions.
Yes, a very important part of our response, I think, not just in federal institutions, but in any of the correctional institutions across the country. But certainly we have been working very closely with Correctional Services Canada. There have been a number of outbreaks, and in different federal correctional facilities. What we've been trying to do is to support them in terms of infection prevention or control advice, ensuring that they're well linked into the local public health system, that they have protocols in place to prevent the introduction and spread of the virus. As well as right now, we have provided an epidemiologist to British Columbia to further understand what the transmission dynamics were in Mission, British Columbia, where there has been and is currently experiencing an outbreak. So we will be learning from those experiences to ensure practices in any other institution. So, and also ensuring that there are personal protective equipment, for example, for essential service workers, including staff, but also under circumstances where social distancing is difficult, to sort of maximize how that can be done under that setting as well. Hygienic measures and everything else, cohorting of people who are sick away from those who are not. And expanding testing in those settings as well. I think these are settings where lab testing needs to be prioritized. So all of that is happening right now.
And one follow-up?
With respect, some of those things aren't happening, though. I mean, when you talk about testing, there's only been, I think about 500 tests done, and most of that's only the last couple of days. PPE is not being widely used. Some nurses say they're not being given adequate amounts. Inmates are still being moved from institution to institution. A lot of the things you're encouraging just aren't being done, and I think that might be the cause of some of these outbreaks. And some healthcare professionals have been voicing concerns, saying that the only way to really enable social distancing is to start decarcerating people or reducing the number of people in individual institutions. Would you endorse that sentiment? And do you feel the government is actually listening to the recommendations you're giving?
Well, I think everybody is trying hard. Like the same with long-term care facilities. I think province and territories really trying hard to prevent the spread of infection, and we know that to be very important. The correctional services environment is another one of those settings. And so I think people are doing, we recognize that, and then people are looking at what the implementation of some of that advice, and which included everything that I just talked about. And from a public health agency's perspective, we will provide the technical advice and support that they need. Many other government departments are trying their utmost to, of course, acquire personal protective equipment. As I've said, the lab testing has increased in Canada, and that will continue to be an area that we are continuously to improve. But for sure, I think relooking at the lab testing approaches in these special settings is very important. I'm sure we will be looking at how that is improved based on the experiences that we've just had.
Thank you, Dr. Tam. We'll now turn to the room for some questions. Julie?
Julie Van Dusen, CBC. Dr. Tam, right now in this building, MPs are debating how to approach Parliament in a pandemic, whether it should be virtual or in-person sittings. So they're having a debate about this. Do you have any recommendations about how they should approach this, keeping in mind there will be some in-person sittings?
I think our advice will be that similar to other workplaces where there's essential services right now, and obviously physical distancing is important. So however this is set up, the advice on physical distancing remains, as well as all the other measures, whether it's administrative, whether it controls making sure people don't go to work if they're sick, having hand hygiene measures observed, and whatever they do in terms of trying to maintain that physical distancing. Many workplaces, of course, have done teleworking, and others just to reduce the amount of sort of mixing and in order to maintain the physical distancing as well. So I think Parliament, like other essential workplaces, needs to have a plan to make sure all of these measures are implemented as they are having their meetings.
Okay. Considering the importance of testing, and some provinces are lagging, do you have any message about what they should be doing?
I think we're working really closely with every province, and it is their collective goal to increase testing in Canada. I do think that that has really increased even in the last several days. So at some point, a few weeks back, we were at about 12,000 tests a day. That gradually increased, and now in the last several days, we've been testing around 20,000. And provinces that were not testing as much before is now testing quite a number more. And so I think we'll see that dynamic increase. Interestingly, though, there are some areas where the symptomatic people have reduced, so that's a good thing, not just perhaps because of COVID-19 activity, but in general, respiratory illnesses have dropped. So in fact, some of the demand for testing has also come down. So I think the number of people being tested a day, we will want to continue to increase that. But that number is a mix of a number of different dynamics as well.
Thank you, Dr. Tam. Next question, Ian.
Ian Woods, CTV News. Dr. Tam, you began today's press conference talking about one national tragedy before moving on to our national crisis we're in, and talking about how we have to talk about feelings and our thoughts about it. So what's a message to someone or to the province of Nova Scotia, people who need to grieve what they just went through in a time where they're already suffering emotionally, or, what do you have to say to them? What can people do to grieve, and how should we do this safely?
I think it is an extremely, extremely difficult time that I think communities have to come together. I know that our public health colleagues are also, of course, providing support to those who have to mourn in the safest way possible. We do know that certain settings can increase the transmission of COVID-19. So I think certainly work with local public health to look at how we best express our sadness and our condolences and support each other in the safest way possible. And some of this might be different to how we've mourned together before, including the tremendous amount of stress as a result of not being able to be physically close to each other, but look for many ways in which you can reach across and share your feelings in a more virtual way. It is going to be tough. There is no doubt about it. But I think people will find a way. And I think, people in Nova Scotia will, in their own way, be able to mourn together. And so, but I do recognize this is particularly stressful. We do have, I think, in numerous jurisdictions, trying to improve our mental health support and, make sure people know who to reach out for, some of the helplines. And I know we've just launched a sort of mental wellness platform. I think it makes a lot of difference if you can reach to anyone in a time of need very quickly. And so I think I would encourage everyone to take advantage as much as possible on those virtual means as well. Thank you.
And in the United States, we're seeing a lot of very sensational photos and videos of protests, people protesting social distancing. And even across this country, there have been very small pocket groups that have popped up. For Canadians who might be getting restless or antsy at home, obviously these protests are, are such fringe groups, but how do we promote people to reject that and to follow with the health proceedings that have been laid out for us?
Yes, I think for Canadians, you've done a great job so far. We know that what you have been doing in terms of physical distancing and all the other public health measures that you've observed have been working. We are approaching another very critical period. And as I said, even if we see the peak of the epidemic in your area, the disease can return very, very quickly. So as the public health system tries to lay out the plans for the next phase of what that new normal might look like, now is not the time to let go of all the hard-earned efforts that you have just put in to slow down this epidemic. We've got to keep going. But the key is, even amongst the most stressful situations, we need to look at that positive voice. And there will be people in your area, your family, where that actually can happen. And I would say that if you have these images of people who are questioning social distancing and these measures, recognizing the population immunity is likely to be quite low at this time, you only have to then look at the images of what New York City has been like, the devastations of tens of thousands of people being severely impacted over a very short period of time, and that is not what we want. And so I think take this really seriously and keep up the momentum that we've gained, and do not let the positive efforts be squandered if we don't tread carefully onto the next stage. This virus will come back. So I'll encourage everybody to try and remain positive as you are helping all of us achieve epidemic control. So thank you.
Thank you, Dr. Tam. Operator, over to you for two last questions on the line.
Thank you. The next question is from Marie Vastel from Le Devoir. Please go ahead. Your line is open. Votre ligne est ouverte.
Yes, hi, Dr. Tam. I was hoping to get your recommendation, I guess, on workers and masks. We see that some workers are going back to work at some provinces, for example, in the construction industry, and those people aren't necessarily wearing masks. I'm wondering how much of a risk is it, given that it's sometimes hard to guarantee that those workers don't necessarily touch the same tools or keep a 2-meter distance at all times. Do you have any concerns about that?
I think our public health advice is that a very systematic approach needs to be provided to workplaces to reduce spread and keep workers safe. So both looking at the actual administrative controls and work arrangements. Sometimes it might mean, in certain settings, screening people before they start work in terms of symptoms and making sure sick people don't go to work. Try as much as possible, maintain that social distancing, provide hand hygienic measures, do more environmental cleaning where possible. But recognizing that in some settings where maintaining physical distancing might be difficult, then the same as in the general population, then consider wearing facial coverings might be appropriate for that setting. So I think each of those settings need to evaluate that risk, and that is to protect others, actually. So in settings where you actually protect yourself against transmission from actually ill persons in certain settings, that's a different thing, that you actually need personal protective equipment. But I think if it is to protect each other in a workplace, then, and you can't maintain social distancing, then facial coverings are a consideration, an option that people can use. But I think that nothing is as important as to at least try as much as possible to maintain that physical distancing and all the other measures.
And one follow-up?
Thank you. On another topic, I guess, I'm wondering how concerned you are about the situation in Quebec. The numbers we're seeing is that about half of the cases in Canada are in that province. Half the deaths as well are in that province. Are you concerned about those numbers? And how do you explain that the situation seems to be so much worse in one province as opposed to the others?
So there's probably many different factors, and certainly right now, the very challenging situation in Quebec includes the long-term care homes and seniors' homes. So I know that all of the health system and public health colleagues are working really hard, I think, to ensure that transmission and spread is reduced in those settings. That's absolutely paramount. So I think you're seeing some of that sort of challenge. And I think it is not just Quebec, but obviously that is sort of very key. And it speaks to, I think, a long-standing issue with managing the spread of infection in long-term care homes and senior residences. So I think that is what they are, working very hard to manage right now. Now, as I said, also as you approach the peak of a outbreak, you are going to also see, unfortunately, and especially because it's many seniors impacted, that the number of deaths reported each day and probably over this next week is expected, I think, to increase in that province. So that, I think, is the picture that we're looking at right now. So a massive focus on getting those settings appropriately protected and the outbreaks managed.
Et voici Dr. Njoo. Peut-être je peux aussi ajouter quelque chose à ce que Dr. Tam a dit. Peut-être vous voulez faire peut-être un suivi avec les autorités sanitaires du Québec, mais ce qu'on comprend ici à l'échelle nationale, c'est aussi le Québec aussi change un peu leur chiffre, comment ils se mettent ça au public, parce qu'au début, je pense que toutes les provinces font des rapports seulement sur les cas confirmés au laboratoire. Après, le Québec a aussi changé parce qu'après, c'était seulement le laboratoire à l'échelle provinciale. Puis après, c'était aussi les rapports des cas confirmés avec un réseau de laboratoires à travers la province. Et maintenant, plus récemment, ils ont changé aussi, ils ont ajouté aussi des cas, comme on dit, seulement liés épidémiologiquement aux autres cas sans avoir une confirmation de laboratoire. Et aussi, c'est la même chose avec les décès. Je pense que c'est fait partie de l'explication pourquoi les chiffres sont un peu plus augmentés au Québec. Merci.
Merci, Dr. Njoo. La prochaine question sur la ligne.
Thank you. Merci. The last question is from Lena Dibb, La Presse canadienne. Please go ahead. Your line is open. Votre ligne est ouverte.
Oui, justement sur la question, Dr. Njoo, que vous venez d'élaborer, est-ce que d'un point de vue national, quand vous regardez les chiffres des autres provinces en dehors du Québec, que ce soit le nombre de morts ou le nombre de cas, est-ce que votre compréhension à vous, c'est que c'est sous-estimé ailleurs, en dehors du Québec?
Je pense que si on parle vraiment à l'échelle nationale, je pense que c'est vraiment en effet une sous-estimé partout au Canada. C'est quelque chose qu'on prend pour acquis que toujours si on a les cas à confirmer, le laboratoire, tout ça, c'est toujours une sous-estimé. C'est presque impossible de voir comme 100%, comme c'est une réflexion de la vraie réalité sur le terrain. Mais c'est toujours pour les provinces et territoires, aussi nous autres, on travaille étroitement avec nos homologues, d'avoir le plus possible, presque le plus proche de la réalité. Donc, avec l'augmentation de la capacité du laboratoire, au fur et à mesure, on voit que les provinces ont fait plus des tests, des analyses, dépistage des personnes touchées par la COVID-19. Et on voit aussi que le pourcentage des dépistages confirmés comme positifs a aussi augmenté. Je pense que ça donne nous autres une plus, comment dire, c'est plus réflexion de la réalité, mais c'est quelque chose, on continue, on fait nos meilleurs efforts à travers le pays pour toujours augmenter, comment dire, pour mieux préciser aussi qu'est-ce qui se passe actuellement.
Point suivi.
Alors, je comprends. Oui, alors je comprends que c'est sous-estimé partout. Est-ce que c'est moins sous-estimé au Québec qu'ailleurs? Et mon autre question à propos du port de masque dans l'industrie de la construction qui a repris au Québec, étant donné que vous nous avez expliqué il y a quelques jours déjà que les gens asymptomatiques et présymptomatiques peuvent aussi être contagieux, je ne comprends pas tout à fait pourquoi vous ne conseillez pas clairement le port de masque pour les travailleurs de la construction qui sont retournés sur les chantiers aujourd'hui au Québec.
OK, premièrement, c'est difficile pour n'importe qui de dire, OK, une province comment a fait une meilleur job de sous-estimer. Est-ce que je peux dire qu'on voit qu'est-ce qui se passe actuellement au Québec et avec tous les dépistages, les tests qu'ils ont fait au Québec, je pense qu'ils ont fait vraiment, comme on dit, un bon job de dépister la population à risque. Et donc, les chiffres au Québec, je pense que c'est pas mal, c'est très bon comme une réflexion de la réalité sur le terrain. Pour la question concernant les masques, comme Dr. Tam et moi, on a constaté plusieurs fois, la chose la plus importante, c'est toujours avoir assez comme on dit, des masques médicaux. Ça veut dire que la protection, l'équipement de protection individuelle pour les travailleurs de soins de santé, les travailleurs essentiels, parce que c'est vraiment pour les protéger contre la contamination. Si on travaille dans un hôpital, c'est sûr, on peut rencontrer quelqu'un qui est malade, qui peut-être qui tousse et qui éternue. Mais pour les autres, dans la population générale, on comprend que oui, il y a peut-être un peu d'évidence que peut-être il y a des gens qui peuvent transmettre le virus aux autres, peut-être quand ils sont présymptomatiques. Alors, l'utilisation, l'option de porter une masque des masques non médicaux pour les gens dans la population générale, c'est plus avec, comme on dit, le concept que c'est pour protéger les autres, pas vraiment pour protéger contre les autres. Donc, je pense que c'est plus important de souligner que toutes les autres mesures de santé publique, la distanciation physique, de bonne hygiène, se laver les mains, rester à la maison si vous êtes malade, c'est plus important, mais c'est toujours une option pour les travailleurs si c'est difficile d'avoir l'option de porter un masque non médical.
Merci, Dr. Njoo. That concludes today's briefing. Thank you.
Thank you. The conference has ended. Please disconnect your line.